Welcome once again, friend, to our series of most commonly repeated one-liners in ENT. Myself, Dr. Naren Singh Chauhan, and today we will be discussing the part 11 of the series, going with the question number 1, which says that C-shaped curve on tympanometry is seen in. So, this is seen in early eustachian tube block or early cases of eustachian tube obstruction. This C-shaped curve is seen on tympanometry. So we have to keep in mind C-shaped curve in tympanometry, then the answer will be early eustachian tube obstruction. Going with the question number 2, which says that rays of pressure from middle ear to inner ear. We have to learn it down. As we go from middle ear to inner ear, the rays of pressure is in the ratio of 22:1. We have to learn it. The change in pressure is of the ratio of 22:1. Now, question number 3, which says that Bara finding in acoustic neuroma. Okay, this is very important question because it is commonly repeated. The commonly asked question from MBBS student about Bara, that is the Bara finding in acoustic neuroma, and the answer is latency of wave 5 is increased. We have to learn it that the wave 5 latency is increased in case of Bara in acoustic neuroma. What is the disease here? The disease is acoustic neuroma. Now, going to the question number 4, which says that Bara is most accurate at. So, Bara will be most accurate at 34 weeks. 34 weeks. So, again, in infants, hearing loss above 80 decibel can be tested by ASSR. Means, if the hearing loss in an infant is above 80 decibel, then which methodology will be used to assess the hearing loss? Then it will be ASSR. A stand for auditory, S stand for steady, S stand for state, and R for response. That is auditory steady state response when the hearing loss is above 80 decibel. Going on to the question number 6, which says that catenary lever provides gain in sound pressure at the level of malleus. We know that what is catenary lever? It provides the gain in sound at the level of malleus. That is how many times? The gain in sound at the level of catenary lever is 2 times. What is? This is catenary lever, which the gain of sound is 2 times. Best time for hearing assessment in infant. So, this is the first month. If we want a screening for hearing in a newborn infant, then the best time is at the age of 1 month. Going on to the question number 8. The tympanogram seen in tympanosclerosis. So, the tympanogram is AS. Sclerosis, that is S. We know that in tympanosclerosis there is stiffening of the ossicular chain, that is also S. So S is for stiffening, S is for sclerosis. So in tympanogram in tympanosclerosis, AS type. And in case of ossicular discontinuity, this is of D type, AD. So D for discontinuity. Now, B type tympanogram is seen in, that is serous otitis media, or any case of fluid behind the tympanic membrane. If there is a fluid behind the tympanic membrane, then in that case the tympanogram will be of B type. In this case, the most common disease with fluid inside in the middle ear, that is the serous otitis media. Going to the last question of today's series, which says that tympanogram in TM perforation. Even if we are performing a tympanometry in a perforated TM, then the tympanogram will be flat. So, the answer here is flat, and this is very important question. This is a new question which is a confusing one. So we have to learn here is that tympanogram in TM perforation is the flat type of tympanogram. This finishes our the part 11 of the series. So if you like the video, kindly share and subscribe and stay tuned since many more parts are on the way. Thank you.